fellows and residents, and I really enjoy the humanistic aspect of medicine. And so, in addition to my work as a psychiatrist, I'm a poet and children's author.
Awesome. And make sure that when we have the live, you leave links to your writing, to your books, so people know, and charities also. Just to introduce myself, some of you know me a little bit, but I'm trying to get you all to know me a little bit better. So my name is Dr. Branch. I'm a cardiologist, and I work mainly in the hospital in Kentucky. It's a rural area. It's an area of high need. It's an area of just high prevalence of cardiovascular disease. And then for a week, I'm off, but I'm taking care of my daughter, taking care of my home. I don't like to compromise, and my family is just as important as my role as a cardiologist. My patients and my family, need me just as much. And so I was able to negotiate a way to be able to continue to prioritize being a mom and prioritize being a cardiologist. And I'm doing it, doing my procedure, doing my thing. So I'm a little proud of myself. Yeah. So let's get into it. So it is Stress Awareness Month, National Stress Awareness Month. And it's also Minority Health Month. I don't really like the word minority, but it's Minority Health Month. But it's basically minoritized folks or marginalized folks health month. So we were talking earlier and telling me you were giving really interesting statistics about the prevalence of stress and just how we're dealing with how stress impacts our lives chronically. So can you tell the audience a little bit about what you're telling me about that?
Sure. So I was able to pull some data from the American Institute of Stress, which I didn't know that it actually existed. So according to
As it
the,
should.
as it should, yes. So according to some numbers I pulled in 2025 from the American Institute of Stress, around three-fourths, so 75% of US adults experience stress. Couple of other statistics that I think are pertinent to this conversation. According to the American Psychological Association Stress in America Report 2025, at least two-thirds of Americans say their stress manifests as physical symptoms, the most common of which are nervous or anxious feelings, followed by fatigue and headaches. And then one other statistic that I think is important from the Occupational Safety and Health Administration.
Mhm.
83% of US workers say they experience work-related stress, which is pretty significant.
It is. And we spend most of our time at work. So we're spending a lot of our time being exposed to these stressors. Those are high percentages. And I don't know about you. I don't know if it's just the times or the weather, but it just seems like it's been just a stressful couple of years, really. And it's hard to really try to get out of that. So why I'm interested in stress as a cardiologist is that you touched on some of these things, is that stress, first it activates your fight or flight. And that's okay if you're fighting a bear. That's okay if you are revving up your cortisol levels. That's okay if you're revving up that RAS system, that renin-angiotensin, and you're trying to perfuse your organs more just so you can fight. But we're not fighting a bear every day. And so after a while, it becomes detrimental when we're constantly in this fight or flight. This relates to not only stress, but anxiety, depression, right? And so if we're constantly in this fight or flight, if we increase renin, as you and I both know, that can cause the kidneys to lead to increased blood pressure and hypertension with this renin angiotensin system. Some people are on ARBs and ACEs. Those kind of inhibit the renin angiotensin system. But if it's constantly being activated, your blood pressure is going to go up. Also, your aldosterone goes up, and you can hold on to fluid and volume. And if you do that, more volume, more pressure, hypertension. Also, your HPA axis gets overactivated. This is your sort of hormonal endocrine axis. And if that's overactivated, then you have increased cortisol levels. Increased cortisol leads to this chronic, persistent inflammatory response. And this inflammation leads to endothelial dysfunction. And why is that important? Because that's the inside of the tubes of your arteries. So if that has dysfunction and it leads to arterial stiffness, then you're going to get hypertension, which can contribute to heart failure, kidney failure, and stroke. And so that's why stress is not just something, oh, I was stressed, but the fact that we're dealing with it constantly leads to this sort of chronic low level inflammation that leads to not only hypertension, but you can also have increased atherosclerosis, heart attack, that kind of thing. So it's just